All right, welcome back to the Pure Playbook. I'm Dr. Dustin Bosson with the Dr. Nate Merhaut. Podcast where we're just going to keep giving information for student athletes and their parents trying to keep up. Where do we go? Who do we trust? How do we prevent? All things that we talk about here and in our practice at the Pure Athlete. What a great couple months. We talked about that last week. We've gone through a couple of the staples of the pillars of the Pure Athlete. We're going to intentionally just keep dripping through the relationship side of things. That's always a part of this, but we've gone through physical a little bit. We've gone through mental a little bit. And so now as we head into the summer, we're going to get a little improv here. We're going to kind of come off the cuff, much like we usually do, but a little less thought out this time. And we're just going to kind of come off the top. We've had a lot of great things through the practice in the past year, let alone the past few months. A lot of good feedback. We have clients and patients interacting with us more via text, via social medias, via other doctors, and collaborating with orthos and helping us continue to meet more coaches, meet more people, and the referrals that are happening. So thank you for that. But also there's going to be other people that could thank you as well as we continue to put out the content, because what I had kind of thought about is talking about some of the stories that were in here, but it sounds like Dr. Nate might be doing that. But let's, you said you know where this one's going to go. So let's hear it. Let's go.
Yeah, so it's definitely along those lines of some of the successes and stories that we've had in the practice recently. But I literally just want to hone in and go into just one case study here. Ooh. And we're going to do a chiropractic case study for you guys today, see where this takes us and show you how you go through the Pure Athlete process from start to finish, not necessarily finish, but how this one athlete has done it and what her success is to this point. And softball and baseball season is underway right now, and that's where we're going with this. This is a softball player. And let me give you a little bit of background. We're good to use her name, right?
Yeah. We're
okay. So Payton is, we'll just use her first name. Payton is our softball athlete that came to us in distress, and she had a shoulder, neck, upper extremity injury, we'll call it. And she had all kinds of stuff going on her throwing arm, and she really couldn't even throw a softball. And it kind of started because she was throwing a softball and got thrown into some situations, which is very common for a lot of student athletes. They get put into different positions that they've never played before, or they're trying out a new one and seeing where they fit best on the team. And that was the situation for this young athlete. And she came to us both in physical and mental distress. So that already hits two pillars.
And I don't know if you know this, but this is the second time.
Yeah. So she was here before.
Here, right. Yeah. And so, yeah, this is the second time. And this girl, I like to label some of these athletes as specimens. She is very naturally gifted, awesome athlete, awesome girl for sure.
Yeah. So
Dr. Nate, before you move on, Dr. Dustin, will you dive a little bit into why Payton was here before her shoulder injury?
I was literally going to go there because that links into the relationship type of the pillar. So go ahead to say why.
Yeah. So she, year and a half ago, she came in with having a lot of knee pain. And one of the softball coaches that we had worked with his daughter, she referred her to us. And we were able to help her with some meniscus pain and patellar tendonitis pretty quickly. And at that point in time, year and a half ago, definitely was more of a symptom-based care plan for her. She felt she was doing better. We had more to do after that, but at the same time, wasn't going to push her to be somewhere she didn't want to be. So in her mind at that point, she was better for all intents and purposes. Right. So when we did the tissue regenerative therapy, the non-invasive stem cell we have in the office for her knee, 3, 4, 6 weeks, keeping her on the field. She progressed even while staying on the field. It wasn't an injury or anything that we needed to pull her from or be super cognizant of, or wasn't any vulnerability of further injury. So we were able to keep her on the field. She had great success and went on. And then it's been a few months now. She's been back for a few months, and she has done very well. So I will leave it there, and you can kind of roll through since you're going to case study and protocol, because the Pure Athlete evaluation wasn't around when she was here.
Not originally, no. Yeah, the second time around, so I was literally going to say, so she came in, we went through more of an acute athlete protocol and evaluation. So we modified the Pure Athlete evaluation for when athletes do come in with an injury. So we took her through the stuff that we could take her through, took her through the upper extremity portion of the Pure Athlete evaluation as well, because that was involved, obviously. And actually, she's coming in again tonight. So full circle right here to redo the evaluation. And actually, we're going to go full force with it this time around, because we want to get her moving in the right direction from a performance standpoint, as well as continue with the injury prevention side of things.
100%.
So we'll go through that with her tonight. But we uncovered a lot of stuff, upper extremity related. There were some layers of diagnoses, if you want to say, with what was going on with her. One of them being TOS, which is thoracic outlet syndrome. So she did have some numbness, tingling into her fingers, a couple fingers specifically, that kind of helped us hone in on what specific nerve root was involved, leading up all the way back into the neck conversation, where we took x-rays structurally and saw some things there. And was able to piece it together with everything we did in the evaluation, which is what it's designed to do, is piece it together, not only from, orthopedics and neurologics and all that, but show them how it all works as a whole and why we're treating it as a whole and not just treating the site of pain, because you can get into a lot of trouble just by doing that and not get the results you want.
The piecemeal effect.
Exactly. So right off the bat, as we started treating, one, just giving her the confidence of knowing what it was, and two, having a plan moving forward with it, that was already a success and something that we knew that she was going to succeed with, because she was happy that was the case, that we had the answers, that we had a plan in place for her. There was a mental component to this case as well, where we often checked in with her and made sure she was doing okay up here in the headspace, because as student athletes, like we've mentioned, it's always a piece of the puzzle when we're dealing with an injury. She didn't know if she was going to be able to continue to play, if she had to be pulled out for the rest of the season, if she really was ever going to play again. And so that was very challenging for her to deal with, because literally she could just not throw a ball, and that you obviously need to be able to do that with the sport. So we had lots of conversations with her throughout the whole process. And, her coming in, when we sat down and did the evaluation and went through the results, she had fun with it, because there were certain things that were unrelated to the shoulder that were like, we're going to need to work on this eventually too. But she's like, oh my gosh, that looks awful. And her and her mom are going back and forth and kind of joking with each other, which, there's that fun component and that atmosphere that we've created where that can happen, and we can take jabs, like we mentioned in the other podcast last week. But there was a mindset shift that had to take place with her that we had to get through, so that, one, she was going to know that she was able to play. It just it was a matter of time and letting the body heal the way it needs to heal to allow that to happen. So now that she played, I'm going to jump a little bit forward. We got the text message the other day, and her mom came in and was telling us what happened. But they literally put her in the game, and she asked us, she's like, do you think I can play this weekend? We're like, go for it. You know, if we thought that there was danger, you're going to injure something more, then we would not let you do anything that would make it any worse. And in my mind, she was like, I'm like, go full force, 100%, good things are going to happen. She went in there, still a little hesitant, I think, and not knowing what was going to happen. Everybody else around here, all the fans, the other moms, dads, teammates, literally just wanted her to get on the field and just be there. And that being a success, doesn't matter what happens. And so that helped the situation too, of like, there was not a lot of pressure on her to like perform or anything, but literally she performed to the best of her ability. And I don't know the exact stats. I think Dustin has them, but
well, when you get a text message video of her stepping to the plate, one of the first times, it might have been the first time since she's been out, and she rips a single over the second baseman's head and scores 2 runs. That's a pretty good sign too. So that's always good. I mean, between the mental component and the physical component, there's a lot of things that we talk about, the structural component, but there's nothing like, getting back into real time and receiving something like that. And, to your point, when it comes to the care we're providing and her having success like that, like our whole goal every time is to keep them on the field as much as possible for just that, and in the certainty that I can still do this, or whatever, that, I am progressing, whatever it is. So morally, ethically, clinically is what we say all the time. Like, if we can keep you on the field doing what you want and love to do, that's what we're going to do, as long as we can do it more morally, ethically, and clinically. So over the weekend, getting that text of like, look at this. It's like, yeah, there we go.
That was really neat. So yeah, obviously having those cool successes, it's a team approach here, both inside and outside of the office. She has a good support system around her. But I'll dive a little bit into like what we did, because some people are like, "What the heck did you guys do?"
Start from the beginning. Like let's stepwise the protocol and kind of tell the story from the beginning of like, now that we've got a little bit of background. Like, okay, now when she came in, I mean, and I'll kind of lead off, is there's a couple different ways that athletes enter our I almost said hemisphere, our ecosystem, and they're either healthy or they're injured, are really the two main things. And then there's the more intense urgent care, like we've had as well. So there's maybe three you can categorize it into. So her entering as an injured athlete, that's how she entered our world. And now we can kind of go stepwise of like, boom, 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 here we go.
Yeah. So entered it as a almost said urgent care, but injured athlete.
That was her brother.
So yeah, that was a different story. But yeah, so entered in as an injured athlete. We went through our general injury evaluation with the added modified pure athlete evaluations to the things that she was able to do. Took our structural films as well. Did the Payton study in the cervical spine for her because it was upper extremity related, and sat down with her and went through the results of that and had the plan in place on what we were going to do.
Why are the cervical x-rays and the motion study so important for like this, like very brass tacks? Like, why?
Well, so the nerves that go down into the upper extremity that control everything in the upper extremity come out of the cervical spine. So if we see stuff and dysfunction within the cervical spine that can correlate with what's going on symptom-wise down in the fingertips, then it's an area that we need to address. And we found that exactly the case with her motion study, as well as just the structural films itself. So there was already a little bit of susceptibility to some neurotension, let's call it, in that upper extremity based on even what our cervical curve looked like.
Yeah.
So there was that component too. But so then we attack it from a treatment plan standpoint. So literally lay it out and say, this is what we're going to do over the course of your treatment plan. And they were excited to get started. And there were lots of aches and pains and things that didn't feel the greatest with her as we were doing things, whether it was from the tissue regenerative therapy, whether it was from some soft tissue work, some exercises, even some of the adjustments. There's that component of it.
The
of
watch
how
and
everything
wait
feels.
does not work here.
No,
like though, there's always something you can be doing that's advantageous, even to an area that you're not supposed to treat directly due to fracture, break, surgery, whatever the case is. And she wasn't on that intensive an injury. There was no fracture, there was no tear, things like that. But you saying that is, it's like, we want people to know, it's like a lot of these, there's another case that we're going through, just got word this morning, but literally to come out of a cast in 2 weeks, and this is just an example, to come out of a cast in 2 weeks of any injury is unheard of. So even now going back with Payton, it's like, okay, we're going to actively get after this immediately instead of just, let's watch and wait and let the pain go down. No, we're going to get after it.
Yeah. And we had to let her know that there were some things that we were going to do, and whether it's stretch, exercise, adjustment, that it's okay to have an uncomfortable response, whether it's a flare up or increased pain, things like that. We manage that appropriately and let them know when it's not okay.
Right.
And if it's not okay, then we do something about it.
Because at the end of the day, like, it's really not about the pain.
No, it's not.
It's not. It's about the injury that is giving the perceived experience of symptomatology.
Right.
It's not about the pain.
Yeah.
That is a bit of a smoke alarm, but yeah, I mean, you got to find the underlying issue and the root cause of that and then proceed from there.
And so with underlying issues with her, we quickly found out that the mechanics of how she was throwing was not the greatest. So we had to even intervene there and in a sense, literally how to teach her how to throw.
Yeah.
Whether that was because she was in pain, she changed the way she was throwing, or literally that was the way that she's learned how to throw and has always thrown that way. So we did some coaching on that. Dr. Dustin threw his rotator cuff and tore his labrum again with that. We won't get there, but
it's out there. You can find the reel.
It's hanging on the sidewalk over there. I picked it up and
hung it over
it.
the stop sign over there.
But
like a pair of shoes.
So that was a
line.
part of the process. One of the things, again, here's me nerding out, but I stress this a lot with our athletes, and this is something that worked wonders for her, was literally teaching her how to breathe. And I need to stop saying literally. I caught myself. That's probably the 10th time, so we'll have a little check mark. And
it's all right. It's stuff you say all the time.
Yeah, stuff and literally. But breathing was something that changed a lot for her. And with thoracic outlet syndrome, to link it to the actual diagnosis, or one of the diagnoses that we had, is if your chest breathing, in a sense, is going to put a lot of compression on those nerves coming out of the cervical spine. So we can have multiple sites of compression with the thoracic outlet syndrome, and the cervical spine was one. The scalenes and the muscles around the rib cage was another, and then there was even a spot down in the elbow that we're continuing to work through right now. But because of the mechanics of how she was throwing, she started to develop something that could have turned into a UCL injury that we're gonna not let happen.
Yeah.
So that is coming with her, and that's really the only thing that's bothering her right now is a little bit of elbow pain, and we expect that at this point that would be the case, but we're going to take care of that here in no time. So we've done that. We progressed a lot of things from a movement pattern standpoint in the gym. We are about to retake her structural films and see the changes there, which we're going to see awesome changes with both the motion as well as the structure of the spine. And from a research standpoint, they say 12 to 18 months of time before you're going to see some structural changes, but we see that a lot sooner.
Yeah.
And it's just because of how we implement things and what we do and the techniques we use. So that's going to be exciting to show them those changes with that, because we know it's changed just based on how it feels on the table, as well as how she looks in person. So there's that component of it. The tissue regenerative therapy that we implemented hit that pretty hard in the beginning, and it's common for us to taper that off a little bit. And the nice thing about that is the stem cells still work continuously after even the last treatment is done on that one. So there's still the effects of that's taking place, and even getting down into the elbow and the UCL for that. And then some coaching and some tips and tricks and tools on active recovery and things to do from the recovery standpoint, because she was not doing it the way that we wanted her to. Right. So we had to guide her in the right direction with that, so that the repetitive stress and the overuse injuries don't keep coming into play with her.
Yeah. So, I mean, if anything, I mean, just, we hope that people hear, the extent to which we go through each of these athletes, and really whether they're injured or not doesn't matter. Right. So I'm just going to go back and kind of summarize the timeline of, I gave the 3 entry paths into our ecosystem. You're either healthy, looking for prevention, get all the data you can with the Pure Athlete evaluation right off the hop and go. You're injured, you come in here, we do an injury evaluation, we go through orthos, neurostructural, and we go through that entire thing, figure out what that diagnosis is, what are we dealing with, or what all are we dealing with. And then there's the urgent care side, which is similar to the injury side, just a little more intense. Maybe we are looking at break, fracture, high ankle sprain, knees that look like cantaloupes, whatever it is. And while it might be injury, sprain, strain, well, I mean,
that's an odd image in my mind now.
I remember when my dad tore his ACL, that sucker looked like a cantaloupe. It was huge. Or, the golf ball you get in your ankle, or the softball that looks like hanging off the side of your ankle from an ankle sprain. And then we continue to proceed from there. And then we gather all of this data. Ideally, you do the Pure Athlete evaluation. You're able to do that either at the time or once we get through that injury. We get a lot of this data. We hook them to technology. We've already taken the film. So we've got neurostructural, physical, ortho evaluation all done. We do have an option, which we're probably going to make pretty much standard going forward with our athletes here shortly, is the metabolic side as well. Right. We've got a recovery protocol, and these are all things we can do here. These are also things we coach on to do out there. What you're not going to see from us is your typical, do your band work and this and this. And it's like, everybody gets those. This is dialed in individually to each person, each athlete or parent who is under care, if that's what they're needing as well. that we go through and take the time to do that very specifically, methodically. And while it might look the same from athlete to athlete somewhat, there's still the intention and specificity of why we're doing what we're doing. Because at the end of the day, we all know what the standard has been is anything that you do is 4 to 6 weeks. I mean, for the most part, 99% of the time, anything you do, jammed a finger, 4 to 6 weeks, rolled an ankle, 4 to 6 weeks, have a concussion, 4 to 6 weeks. Like everything is 4 to 6 weeks. And it's a lot of watch and wait. That's why we don't call it PT or physical therapy. If I'm going to meet people where we're at, yes, we do those things here. We can. There's a lot of times we refer those things out. What we do here, what we're calling it for right now, is that performance rehabilitation, which is more specific, more dynamic. It's not your status quo straight out of the book. It's all evidence-backed and evidence-based, but there's a methodical reason of why, but you're going to get a lot of information too, so that now we have baselines and all of these things going forward. It's just a much more specific way to give proper healthcare to these athletes and get them back on the field or on the court or underneath whatever scoreboard they're underneath. Because imagine being 16 years old, being very capable to have a very awesome career if you want it, and then having it felt like it's taken away because it's like, oh, suck it up, you'll get it, just take some ibuprofen, do this, and it's like still not getting better. Well, suck it up again, and still not getting better. Suck it up again. And sometimes we fall into that even as parents and coaches, and then it gets very degrading, and it's like, I don't want to do this anymore. Right. And this is where she was at. And it's like, so to have it, and it's about the injury. Yes, it's about the symptom, but we've talked about this and I talk about it all the time, it's like, a lot of times that's the easy part.
Right.
But this person might have already fallen apart here and here that they don't care if they do it again or not.
Yeah.
And so to see all of that come full circle, that's in a nutshell what you can experience: right, wrong, and different, high drama, low drama to some extent. Whether you're up here all the time and you love the game you play and you never have the low, there's still that mental and that hard aspect that when you feel like you're doing and you see yourself doing all the right things and taking action in that, you continue to be on the rise.
Yeah. So I'm looking forward to tonight when she comes in, one, just to see, because we haven't seen her since the weekend yet, but see how she comes in here and responds and is excited about the results per se of where she is now, but then also to run her through the evaluation again and even build her stronger from there, because now we're getting into basically the preventative side of things.
By the way, Sam, make sure you text her and tell her not to wear Crocs.
Yeah.
Please.
Tell her to wear athletic clothes and not Crocs.
And tennis shoes. Yes.
Thank you.
So, but yeah, that'll be exciting tonight. And we have lots of other cool cases like hers, but hers was one that stuck out this week because of the success we had over the weekend. And maybe we'll make it a point every once in a while to throw in a chiropractic case study for you guys with the Pure Athlete, so that you can see the process, you can see some of the common injuries that we're treating, and you can see the outcomes. And we'll even throw some in that are challenging, where that's not the success that we would expect to see. So you can see that is also real, and how we approach that, and in what direction we go with those athletes, both from a mental, physical, and relationship side of things.
Yeah, absolutely. No, I like that. It's humbling to see the variety of things that we're seeing now. Not that any of them are too obscure. However, it's also things that we're seeing they're bringing to us first before anything else, which is awesome. And if we need to refer to PT, or if we need to refer to ortho, if we need to, whatever that case might be, we're literally navigating that for them, and we've created that whole experience. So that's a pretty good look into a little bit of a day in the life of what it might look like from an injured athlete. There's plenty of more information in there that we could go through and maybe do a whole story on, and who knows, maybe we'll even have them, we'll do like a bonus drop, see if they want to jump on a podcast and do a bonus drop. But at the end of the day, this is the standard of care that we're providing, from the level of entry to the return to sport to the personal coaching, the mental coaching side of things. There's just so many different avenues that we're committed to giving to student athletes and their parents that are trying to keep up. So I like it. I didn't think you're going to go quite that direction, but success is real. Do the right things for an extended period of time. It doesn't always look flashy, but when you have a methodical plan, you have data, you have things you can see and things you can measure, and appropriately, you can then start to manage and correct a lot of the underlying issues, which is what it's all about.
Yeah, definitely.
Cool. Producer Sam's got her thumbs up. I think she's going to stay mostly quiet. We offered her the opportunity to like really fire away in here, but
wow.
No, you don't get to talk now.
Okay, fine.
Shut it off. Shut off. We're done.
Okay. Well, one last thing. I did want to just really put in perspective kind of what's going on with Payton. She's played one. This is her first tournament back. Mom said she's now tied for 4th in RBIs on her team after one tournament.
Okay.
There it is.
So
come to the Pure Athlete. Make your statistics go
top
up.
5 in RBIs.
Yeah.
Guaranteed.
Yeah. So just to really put in perspective the athlete that she is and what her care has done for her, for sure.
Cool.
Sweet. Anything else? Final thoughts?
Mm-mm.
All right. Let's wrap it up. Hope you guys have a great rest of your week. See ya.